Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Roundhill, Virginia, discussing the benefits of dentistry and how they can help restore your dental health with one of this region's top dentists, Dr. Sean Grady. Dr. Grady received his DDS degree from Virginia Commonwealth University and is a member of the prestigious American Academy of Cosmetic Dentistry, and again is widely recognized as one of this area's top dentists. Welcome, Dr. Grady. It's a pleasure to have you on the program.
Thank you for having me.
Your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about, and I wanted to begin, if I may, by asking you if you can please tell us what some of the benefits of dentistry are.
Well, there's an enormous amount of research that's come out lately about dentistry and the benefits. It's interesting because years ago, they used to think, or the general public would think, that there's not a really correlation. Your mouth was separate from your body. But now there's many studies that have strong findings and strong correlations with the cardiovascular system. Periodontal or gum disease can actually cause heart conditions. It does affect pregnant women. It can cause respiratory conditions, osteoporosis. In fact, there's a 49% greater risk of men developing kidney cancer if they have periodontal disease. So there's all kinds of effects on the body, and there's all kinds of benefits, not only the cosmetic and structural, the obvious benefits of I have a tooth that's hurting, I need it fixed, or I need to have a tooth replaced. But there's all kinds of other benefits of dentistry that correlate to the entire body.
What are some of the more common dental problems that you're seeing from patients that are coming to your practice?
I'm seeing a lot of just general dentistry, a lot of people come in to just get their cavities filled and things like that. Yes. But one of the big things that I see that's just been a phenomenal increase is dental implants. Dental implants were thought of 20 years ago when I first started practicing, not quite so mainstream. Now, dental implants, that's the way to go, and it's it's 99% predictable. And if I was missing a tooth and somebody didn't offer me a dental implant, it's just not right. But anyways, that's the most phenomenal thing I think that's happened in dentistry in the last 20 years.
And can you tell us about some of these treatment options that you just touched on, and elaborate a little bit more about what's involved, who might be a good candidate for some of these?
Well, I think with the Invisalign or the invisible braces, anybody would be a good candidate that you can think of Invisalign as modern orthodontics. If you can, if you have teeth that are crooked, or if you have malocclusion, your teeth aren't lining up right, or you've just always wanted your teeth straightened, you can have Invisalign. People used to think about Invisalign as it just does minor things here and there, but it can do today what orthodontics, traditional orthodontics, does. And it just takes somebody that has done it for years and years. I've been doing it for 20 years. It's amazing.
Yes, indeed. That's a long time. You're certainly very, very well experienced. And I would think Invisalign would be a great treatment for also so many of the busy professionals that are in the working world, that are interacting on a regular daily basis with other folks. And as you touched on, it's basically literally invisible. So they can get their teeth straightened and all of those problems corrected without looking like they're wearing the traditional braces.
In most cases, it takes 6 months to a year. You're not involved in the process for a long time. Insurance recognizes it, it's easy, and it's about the same cost as traditional braces.
That's
so
wonderful.
I always tell people, if you're considering traditional braces, if you've ever considered that, you should consider invisible braces.
As far as people out there that want to enhance their smile or get that new smile, can you tell us about some available and effective treatments that can take us to that level?
Well, there's a number of things that I offer here. One of them is porcelain veneers. And porcelain veneers are, you can think of them like thin contact lenses. They just fit on the front surfaces of the teeth. So with porcelain veneers, sometimes you have to take a little bit off the front surface. You don't have to grind the teeth down all into little stumps. Sometimes people think you have to do a lot of drilling. And you come in and you can have 6 or 8 or 10 porcelain veneers. We can pick out the shape of your teeth together. We can pick out the color, the selection. You come in one day for a couple hours. 2 weeks later, you come in and you have a brand new smile.
That's wonderful.
It's just that easy. It's just that easy. But it takes somebody that has the experience. Just in cosmetics alone, I have over 500 continuing credit hours just in that. And that's not just sitting in a classroom. That's learning from the best of the best in America in a laboratory setting and working on patients and through the Academy of Cosmetic Dentistry, really learning your craft. And it does take a while. And now that I'm there, it's an amazing service I can offer my patients.
Really, you're actually like an artist, doctor, when you think about it, because not all two smiles are alike. Everyone is unique. Everyone wants something different that individualizes that particular patient. So you have to kind of meld and work with them and come up with the best solution to give them that smile, but at the same time, a smile that looks natural.
Now, we do offer something for our teenagers that come in. They may have had their traditional braces taken off and they have a brown spot or a white spot here and there. And I can do something with traditional cosmetic bonding, no drilling. Moms and dads may not want any drilling done on their teenager. You know, what can you do to help? I can put cosmetic bonding on the front surface of the tooth, make it look great. It's reversible. I didn't do any damage to the tooth, and their 16-year-old that just got their braces off now looks fantastic.
Now, for the folks out there that are very anxious, nervous about going to a dentist, and there are tons of those folks out there, Dr. Grady, I understand you also are provide you in your practice here sedation dentistry, help those folks overcome the fear of going to a dentist and get that much needed dental work done.
We do. In fact, nobody likes to come to the dentist. It's just a fact. I don't take it personally. It's just not the #1 thing on people's list, right?
Yes.
So we understand that. And we do offer sedation dentistry where they can take a couple pills the night before, a couple pills an hour or 2 before they come in. They have to have a driver. We don't want them driving around town.
Sure.
And they come in and they can communicate with us and talk with us, but they don't remember the appointment. They're very lethargic, but we can communicate with them and do what we need to do, and they leave. They barely have any memory of the procedure, and they get it all done. So sedation dentistry, it's an amazing option. And for somebody that's at a fear of the dentist, we can sedate you, and we can get a lot of dentistry done in one appointment. People are busy these days. They don't want to have to keep coming back for 6, 7, 8 dental appointments. They can come in here. They can get sedated. 2 or 3 appointments later, everything's done.
That's wonderful, and in a very efficient and safe manner, by the way.
Exactly.
And as far as, and I'm sure it varies, doctor, as far as each particular patient regarding how long it would take to get some of these treatments done. But in general terms, what are people looking at? 1 or 2 visits for what you've been telling us about?
1 or 2 visits, absolutely, absolutely.
So it's not something that they have to look at as like over a couple of years or over like several visits. In general terms, 1 or 2 visits and they're done, and they've gotten that, either their teeth are getting straightened through the Invisalign, or they have that new smile or improved their smile.
Yep, and I do a lot of full mouth reconstructions. I do a lot of reconstructive and implant dentistry where somebody may be in their 40s or 50s or 60s, and their teeth have gotten so short over the years from the grinding habits and things like that. And sometimes their wives come in and they say, my husband has these really short teeth. How can you help him? And so I will put crowns, cosmetic crowns, on all of their teeth. And in 2 visits, they've got a brand new smile. Their teeth are longer. And the best thing is their wife's happy.
That's very important.
Yeah, yeah.
Very important indeed. Now, what type of results can folks expect from these treatments that you've told us about?
Well, I spend a lot of time with each patient trying to figure out what exactly they want, because everybody wants something a little bit different. So I think the great thing about this practice and my practice here is that I take the time to really personalize their treatment. Some people want long teeth, some people want shorter teeth, some people want, there's all kinds of different ways that you can make teeth. So I really try to listen to them. I'll often ask somebody to bring a picture of yourself in when you were 25 or 20. And that's a great idea. So they bring me in a picture of their wedding day, say, I want my teeth to look like that. I communicate that to the lab digitally. I send that off to them. I talk to the lab guy, and away we go.
That's wonderful. Certainly, your practice here is like a spa. I mean, you're state of the art with all the latest technology, and that's one example of it.
Exactly.
How long would some of these results last? For instance, with porcelain veneers, we hear a lot about that.
Yeah, porcelain veneer, the average lifespan is 10 years. So some of them last longer, some of them last a little bit less. But if if you're looking statistically, 10 years.
That's great to know.
Yeah.
And as far as dental implants, doctor?
Dental implants, the implant itself, it's going to last you a lifetime. It is. 99% success rate. I have, in 20 years, I've only seen one case fail, and that was from a patient in California, and it was an error from the surgeon that placed it. But other than that, I haven't seen one fail.
So basically a 99.9% success rate.
I haven't seen that,
We're now going to meet a patient of Dr. Grady. Welcome, Carlene. It's a pleasure to have you on our program.
Thank you. It's nice to be here.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. So on that note, I'd like to begin, Carlene, by asking you, what dental problem or problems were you experiencing that brought you to Dr. Grady?
I had lots of discoloration with my teeth. They were faded and just not very nice to smile with.
Sure. So you become conscious of it, and you just didn't like the way it was looking. So
no.
You came to Dr. Grady, and what did you have done?
I had veneers, porcelain veneers on my front teeth, the 4 on the sides, and then the 2 in the front are crowns.
Well, they certainly look very nice. Look very
Thank you.
natural. So how do you feel about the results?
Oh, I love them. They're great. Very natural. They look great. People always say I got a nice smile.
Yes, indeed. And how long did it take to get them put in, to have the veneers?
I had 2 done at one time, and then the other one's done another time. So it just takes
2 visits, basically?
2 visits, right. And they're in, he sends them up to lab, calls me up, they're in, puts them in really fast.
That's wonderful. Well, you certainly, look at you, you're glowing, you've got a beautiful smile, no discoloration anymore.
No.
Right? You've got to feel wonderful.
Feel great.
And for the folks out there watching, Carlene, what would you tell them about Dr. Grady and his staff?
They're just very professional, and they are personable. They call you, they tell you what, when you have to come into the doctors and what to expect when you're going to come in. And they take their time with you, and they explain everything from cost to, the actual procedure itself.
Wonderful.
Okay.
Thank you again for joining us and being a guest in our program.
Thank you.
It's our pleasure. We're now back with Dr. Grady. I must say, Dr. Grady, Carlene was very pleased with the results.
Thank you.
Dr. Grady, we're literally out of time, but I wanted to ask you before I let you go, you and your practice here in Roundhill, Virginia, certainly established a reputation for excellence, not only in the field of dentistry, but also patient care. And I just wanted to ask you, what would you say helps separate you and your practice apart from many of the other dentists?
Well, that's a good question. I'm glad you asked. I think the number one thing that separates us apart from the other dentists in the area is our personalized individual care. We have one treatment suite that I work out of, and we have one hygiene treatment suite that my hygienist treats out of. And most dental offices you go into will have 2, 3, 4, 5, 6 treatment rooms. And how many things can you really do well one time? When you're here with me, you're here with 100% of my focus and attention, and my staff's focus and attention. And so the number one thing that sets us apart is our personalized attention to detail and to you and to what you want. And also, it's a private setting. There's not 10 other people listening to what kind of treatment that you may or may not want. You're here one-on-one with me. The second thing that sets us apart is quality, is our dentistry, is that I personally have spent a number of years working at my craft, getting better and better to the point where I do feel strongly that we offer the best of the best here. So not only are you getting personalized care in a private setting, nice relaxing environment, get a great product, whether it's cosmetics, Invisalign, implants, general dentistry, a cleaning, we're paying attention, and you're not coming into a dental factory, you're coming into your family here.
Yes, indeed, and our research has certainly borne that out. You all really take care of your patients like family, and that's what the patients even have told us. And on that note, I'd like to thank you, Doctor, for joining us, being a guest on our program. We'd love to have you back on in the future, Dr. Grady.
Thank you for having me.